This morning in the Sunday Spotlight, learning from COVID-19. With the pandemic all but in the rearview mirror this morning, we're hearing from local experts about what they'd keep and also change from getting the word out to combating misinformation. They say there is a lot to cover moving forward, from precautions to vaccinations and testing. I speak exclusively with the Pima County Health Director, Dr. Teresa Cullen, about what she has learned and her message for folks here and across the country who are not vaccinated and didn't follow health advice. We start with where numbers are right now across Pima County. Still, you see here hundreds of cases just in the last month and more than a dozen deaths. While this is much better than it was even earlier this year, Dr. Cullen says taking steps to prevent COVID from spreading to keep these numbers from climbing should still be something you're thinking about. The precautions, the social distancing, the masking, all but gone here across the country. Wanted to get your thoughts on that.
Well, I'm hoping they're not all gone. Remember, we hope that if people are ill, they still stay home. They may not know they have COVID, so they should stay home. But because the numbers are so low, and as you note, they are lower than they've ever been right now, about 20 cases per 100,000. Huge win for the community. I think the elimination of most measures are okay. I would really encourage people to remember basic hygiene, though. This is a respiratory disease. Make sure if you're ill, you stay home. Remember to wash your hands. That prevents lots of diseases. And get vaccinated.
I want to talk about Pima County. Obviously, there's still some testing sites. Testing kits are still available for free at the libraries. There's still vaccines. Are people showing up to these things? Are people still picking up these tests? And how much longer do you think these things are going to be in place?
Okay, so let me do each of them separately. Testing, test kits are available at most libraries. Call ahead to make sure they still have a supply. There's also test kits given out at our Abrams Public Health Building on Wednesdays from 10 to 2. People are still picking them up. Our hope is that we will have the supply through the end of this calendar year, so into December. In terms of vaccines, I know this is surprising, but we still have people getting their first vaccine and people still get their boosters. Our support of vaccines is at our clinics. We no longer have them at the Abrams building, but we're also doing a lot of mobile events and people keep showing up. We're really grateful for that.
Is that reassuring, or how big of a deal is that, do you think?
I think it's reassuring for me when we look across the country and we look at the booster, which is what most people are getting now. The numbers are still pretty low, below 50%. In Pima County, we're about 55 to 60%. We see a slow creep up every week with people getting them, but it is positive here.
Moving ahead here, as a health expert and one of the faces when it comes to getting us through this pandemic, what do you think is your biggest takeaway from this pandemic moving ahead to the next serious disease or the next pandemic?
This is a great question. You know, we have been monitoring the way we respond. And that is the most important thing, I think, as we go to the future. We have now figured out, for most things, we hope, how to have a more rapid and appropriate response. So what that means is, from an epidemiological perspective, there's a new disease. We know how to recognize it. We know how to test for it. Obviously, in certain cases, we would know how to treat for it or not know how to treat for it. But the most important thing is we know how to monitor that. We've now figured out how to track that data and to show us where there are holes or potential ways we can improve our response. So that's what you want from a health department, is that we can respond to crises.
When you're looking at COVID and moving ahead, how much do you think you learned from this pandemic?
I think we learned tremendously, and I think we're still learning. We are in the process of doing what we call after action reports, and they're multifaceted because there were so many components and so many areas that our response touched. But we have learned a lot. We've learned a lot about communication, engagement with the community, how to engender, I hope, trust, how to have people how to ensure that we can be at the point of care where we need to be so that you or your family or the community can get the care that is needed.
I want to talk about misinformation. It has been a big part of this, has been for years. And it's part of the reason the number of deaths are the way they are. When it comes to moving forward, specifically dealing with misinformation, is there anything you would have done or would do differently?
I think the one thing we have learned is that the more we can simplify the information, the better it is. Clinical information gets confusing really quickly, even to me as a physician. And by simplify, I don't mean take away the message, but I mean ensure that it is understandable to different groups and that we message to different groups. So people have different concerns, they have different understanding, and we need to embed this concept of health literacy. That means that people are literate and understand health information itself into how we message.
One more on this misinformation part of it. We are still hearing it today on vaccines. We heard Marjorie Taylor Greene in DC just the other day. We're hearing something from RFK about vaccines. We're still hearing that. As a health expert who has been at the front of this, how frustrating is that, would you say?
It is frustrating, but I think I have a responsibility as the Pima County Health Director to understand where people are, to understand what their concerns are, and to try to give them appropriate information to address it. And I think that that's the key here, is that there's not a sledgehammer here to get people to understand about, for instance, vaccination. There is data, and we need to figure out how to have a dialogue with the individual, with the community, with their family, so that we can allow people, obviously, to make their own decisions. Though from a county health department, as you know, I believe strongly in vaccinations. And I also believe that the misinformation has hurt the community because people have chosen to not get vaccinated.
And Dr. Cullen says the goal moving forward is to help everyone understand they can trust the advice and guidance coming from the health department. She also tells me one big focus when it comes to getting the word out is social media. She says the goal is to inform, entertain, and at the same time, save lives. That's all for this week's Sunday Spotlight. Join me again here next week as we take another look at another issue impacting Southern Arizona. 13 News Live this morning is back after a quick break.